Good morning, everyone. So today we will be reporting the chapter 38, sensory perception. But before that, let us introduce ourselves. I'm Hannah Maliga.
I'm Sister Kassan.
So today, our learning objective is our learning outcomes is after completing the chapter, you will be able to discuss the components of the sensory perception process, describe factors that influence sensory function, identify clinical signs and symptoms of sensory depression and overload, describe essential components in assessing a client's sensory perception function, discuss the factors that place a client at risk for sensory disturbance, develop nursing, diagnosis, and outcome criteria for client with impaired sensory function, discuss nursing intervention to promote and maintain sensory, and lastly is identify strategies to promote a therapeutic environment for this client with acute confusion or delirium. So, next is introduction. An individual's sense are essential for growth, development, and survival. Sensory stimuli gives meaning to event in the environment. Any alteration in individual sensory function can affect their ability to function within the environment. For example, is many clients have impaired sensory function that put them at risk in the health care settings. Nurses can help them find ways to function safely in this often confusing environment. Then, the components of the sensory experience is sensory reception and sensory perception. Sensory reception is the process of receiving stimuli or data. These stimuli are either external or internal to the body. So, sensory reception is essentially the body's way of the perceiving and processing information from both the external environment and internal bodily functions. It it's the initial step in the complex process of sensing the world around and within us. Then, external stimuli are visual or sights, auditory or hearing, olfactory or smell, tactile or touch, and gustatory or taste. So, the external stimuli, these are the stimuli that originated from the outside of the body and are picked up by sensory organ. So, the first is visual or also known as sights. It is the perception of the light and color through our eyes. The next is auditory or also known as hearing, perception of sounds waves through the ears. Then next is olfactory or also known as smell, perception of airborne chemical molecules through the nose. Then next is tactile or touch. It is the perception of pressure, vibration, temperature, and texture through our skin. Then lastly is the gustatory or also known as taste. Perception of the chemicals dissolved in saliva through our taste buds, primarily on our tongue. Then next is gustatory stimuli can be internal as well. Other types of internal stimuli are kinesthetic or visceral. Kinesthetic refers to the awareness of the position and movement of the body parts, while visceral refers to any large organ within the body. So the internal stimuli, these originated from within the body and are detected by specialized sensory receptor. Um, the first is genitory na the first is gustatory or taste. While taste is primarily related to external stimuli, foods and foods and wait lang. Foods and beverage, internal bodily changes can also influence taste perception. Then, next is kinesthetic, awareness of the position and movement of the body parts which is sensed by receptor in muscles, tendons, and joints. This sense help us maintain balance, coordination, and posture. The next is, lastly, is visceral. It is a perception of internal bodily sensation arising from organ such as the stomach, intestine, and the bladder. This sensation can include our feelings of hunger, fullness, discomfort, and pain. The next is sensory perception. It involves the conscious organization and translation of the data of stimuli into meaningful information. Sensory perception is the cognitive process through which the brain interprets and makes sense of the information gathered through sensory reception. It involves not only receiving sensory um, input but also organizing, analyzing, and translating that data into meaningful information that we can understand and respond consciously. Next, for an individual to be aware of the surroundings, there are four aspects of the sensory process must be presented. First is stimulus. This is an agent or act that stimulates a nerve receptor. Example include is light, sound, temperature, pressure, chemicals like taste or smell, and pain. Receptor. A nerve cell acts as a receptor by converting the stimulus to a nerve impulse. Most receptor are specific, that is sensitive to only one type of stimulus, such as visual, auditory, or touch. Next is impulse conduction. The impulse travels along nerve pathway either to the spinal cord or directly to the brain. So, impulse conduction, once the receptors detect a stimulus and convert it into nerve impulse, these impulses travel along nerve pathways either to the spinal cord or directly to the brain. This transmission or nerve impulse is essential for relaying sensory information from the peripheral nervous system to the central nervous system, or also known as brain and the spinal cord. Next is perception. Perception or awareness and interpretation of stimuli takes place in the brain, where specialized brain cells interpret the nature and quality of the sensory stimuli. Specialized brain cells and analyze the incoming sensory information to generate perceptions such as sight, sound, taste, touch, and smell. Perception allows individuals to recognize and interpret the nature, quality, and significance of sensory stimuli, enabling them to respond approximately to their surrounding. Next is arousal mechanism. For the individual to receive any interpret stimuli, the brain must be alert, also referred to as arousal. The reticular activating system, or RAS, in the brainstem is thought to mediate the arousal mechanism. The RAS has two components, the reticular excitatory area, or REA, and the reticular inhibitory area, or RIA. The REA is responsible for arousal and wakefulness. Then, so the reticular excitatory area, or REA, these components of the RAS is responsible for promoting arousal and maintaining wakefulness. It helps keep the brain attentive and alert, facilitating the processing of sensory information from both internal and external source. And then the reticular inhibitory area, or RIA, in contrast to the REA, the RIA serves to inhibit arousal and promote relaxation. It plays a role in regulating sleep-wake cycle and modulating the overall level of alertness in the brain. Next is sensorystasis. Is term used to describe the state in which an individual is optimal arousal. So, sensorystasis refers to the state of optimal arousal in an individual. It's the balance of arousal level where the brain function must most effectively. So next is awareness. Is the ability to perceive internal and external stimuli and to respond approximately through thought and action. Then, moving on, there are factors of affecting sensory function. First is developmental stage, culture, stress, medication, illness, lifestyle, and lastly is personality. So, first is developmental stage. Perception of sensation is critical to the intellectual, social, and physical development of infants and children. Infants learn to recognize the face of their mother or caregiver and establish bonding essential to later emotional development. Young children respond to music by singing and dancing as they begin to interact with their peers with their peers it with their peers in groups. As children grow, they learn to interpret visual and auditory signals when preparing to cross the street. Adults have many learned responses to sensory stimuli. The sudden loss of or impairment of any sense therefore has a profound effect to an individual of any age. Then perception is crucial for infants, intellectual, social, and physical growth, emotional development, and attachment. It influences daily interaction and adulthood. And sudden loss or impairment can disrupt establishing a perception pattern. Then, um, next, the next is state of awareness. So first is full consciousness. The description is alert, oriented to time, place, person, understand verbal and written words. Next is disoriented, not oriented to time, place, or person. Next is confused, reduced awareness, easily bewildered, poor memory, misinterpret stimuli, impaired judgment. Next is somnolent. It extreme drowsiness but will respond to stimuli. Semicomatose can be aroused by extremely or repeated stimuli. Next is coma, will not respond to verbal stimuli. Then next is culture. An individual's culture may determine that amount of sensory stimulation that he or she consider usual or normal. Um, the sudden change is cultural surrounding experienced by immigrants or visitor to a new country, especially where there are difference in language, dress, and cultural behavior, may also result in sensory overload or cultural shock. Cultural deprivation or cultural care deprivation is a lack of culturally assistive, supportive, or facilitative acts. The displacement of clients from their origin of birth can lead to a sense of isolation and loneliness. Next is stress. During times of increased stress, people may find their sense already overloaded and thus seek to decrease stimulation. For example, a client dealing with physical illness, pain, hospitalization, and diagnostic test may wish to have only close support people visit. Um, During time of stress, individuals often experience sensory overload, leading them to decrease stimulation to regain control and comfort. This is a natural response to protect themselves from further strain. Caregivers and supporters networks should respect this preference and provide the necessary space and support for individuals to manage their stress effectively. This help them focus on essential tasks and recovery. Next is medication and illness. Certain medication can alter an individual's awareness of environment stimuli. Narcotics, anti-epileptic agent, and sedatives, for example, can decrease awareness of stimuli. Some antidepressant can also alter perception of stimuli. Where administering this medication, the nurse is responsible for protecting the client from injury that can result from impaired sensory perception. Some medication, if taken in large doses or over a long period of time, become ototoxic, injuring the auditory nerve and causing hearing loss that may be irreversible. Then, uh, medication can alter sensory perception and cause ototoxicity, requiring vigilant administration by nurses to protect clients from injury and potential hearing loss. Then, um, next is lifestyle personality. Lifestyle can influence the quality and quantity of stimulation to which a client is accustomed. Clients' personalities also differ in different of the quantity and quality of stimuli with which they are comfortable. Some clients delight in constantly changing stimuli and excitement, whereas other prefer a more structure with few changes. Um, Lifestyle and personality is essential for healthcare professional when providing care to the client. By recognizing individual differences in sensory preferences and tolerance, healthcare provider can tailor their approaches to communication. Environment their approaches to communication, environmental management, and therapeutic intervention to better meet the needs of each client. This personalized approach promotes comfort, engagement, and overall well-being. Then, next is sensory alteration. Individuals become accustomed to a certain sensory stimuli. And when this change mark and an individual may experience discomfort, for example, when client enter a hospital, they usually experience stimuli that differ in quantity and quality from those to which they are accustomed. These changes may cause client to become confused and disoriented. Particularly if they are already dealing with illness, pain, and emotional distress, it's essential for healthcare provider to be aware of these potential challenges and to take steps to minimize sensory overload and promote a comfort and supportive environment for a client. Then, next is sensory deprivation. Sensory deprivation is generally thought of as a decrease in or lack of meaningful stimuli. When an individual expresses sensory deprivation, the balance in the RAS is distributed. The RAS is unable to maintain normal stimulation to the cerebral cortex. Because of this reduced stimulation, an individual becomes more acutely aware of the remaining stimuli and often perceives them in a distorted manner. Understanding the effects of sensory deprivation is essential for healthcare providers, as it can impact the person's well-being and mental health. Intervention aimed at reducing sensory deprivation may include providing sensory stimulation through activities, social interaction, exposure to natural environment, and the use of assistive devices to enhance sensory experiences. Next is Box 38.1 sensory deprivation. Excessive yawning, drowsiness, sleeping. Second, decreased attention span, difficulty concentrating, decreased problem-solving ability. Third, impaired memory. Fourth, periodic disorientation, general or nocturnal confusion, preoccupation with somatic complaints such as palpitation, hallucination or delusion, crying, annoyance over small matters or depression. Lastly, apathy or emotional ability. Next is sensory overload. Sensory overload generally occurs when an individual is unable to process or manage the amount or intensity of sensory stimuli. There are three factors contribute to sensory overload. So first is increased quantity or quality of internal stimuli such as pain, dyspnea, or anxiety. Second, increased quantity or quality of external stimuli such as a noisy healthcare settings, intrusive diagnostic diagnostic studies or contacts with many strangers. Then third is inability to disregard stimuli selectively, perhaps as a result of nervous system disturbance or medication that stimulate the arousal mechanism. Sensory overload can prevent the brain from ignoring or responding to specific stimuli because of many stimuli. The individual has difficulty perceiving the environment in a way that makes sense. Next is Box 38.2 sensory overload. First is complaints of fatigue and sleeplessness. Second, irritability, anxiety, and restlessness. Third, periodic or general disorientation. Fourth, reduced problem-solving ability and task performance. Fifth, increased muscle tension. And lastly is scattered attention and racing thoughts. Next is sensory deficit. Sensory deficit is impaired reception, perception, or both of one or more of the senses. Blindness and deafness are sensory deficit. Are sensory deficit. Are sensor are wait lang. Our sensory deficit. When the loss of sensory function is gradual, individuals often develop behaviors to compensate for the loss. Sometimes these behaviors are unconscious. Clients with sensory deficit are at risk for both sensory deprivation and sensory overload. So, sensory deficit refers to impaired reception, perception, or both of one or more senses such as vision, hearing, taste, smell, or touch. This deficit can lead to conditions like blindness and deafness and can result in compensatory behavior such as relying to other senses using assistive devices or modifying their environment. Clients with sensory deficit are at risk for sensory deprivation and sensory overload, which can lead to discomfort, confusion, or agitation. Healthcare providers must address this risk and provide appropriate stimuli. Next is nursing management. Assessment interview sensory perceptual functioning. First is visual. How would you rate your vision? Excellent, good, fair, or poor? Do you wear glasses or contact lenses? Describe any recent changes in your vision. Do you have any difficulties seeing near or far objects? Do you have any difficulty seeing at night? Have you ever experienced blurred vision? blurred vision, double vision, spot moving in front of your eyes, blind spot, light sensitivity, flashlight, or halos around object. When did you last visit an eye doctor? So next is auditory. How would you rate your hearing? It should be excellent, good, fair, or poor. Do you wear a hearing aid? Next is describe any recent changes in your hearing. Next, can you locate the direction of sound and distinguish various voices? Do you experience any dizziness or vertigo? Do you experience any ringing, buzzing, humming, cracking noises, or fullness in the ears? Next is have you experienced any changes in taste? For example, difficulty in differentiating sweet, sour, salty, and bitter taste. Next is, do you enjoy the taste of food as you did previously? So next is olfactory. First is, have you experienced any changes in smell? Do things like food, flour, perfumes, and so on smell the same as previously? Can you distinguish foods by their odors and tell when something is burning? And lastly is, have you experienced any changes in appetite? Changes in appetite may be related to an impaired sense or smell. The next is tactile. First question is, first assessment is, are you experiencing any pain or discomfort? Have you experienced any decrease in your ability to perceive heat, cold, or pain in your limbs? Do you have any numbness or tingling in your extremities? Then lastly is kinesthetic. Have you noticed any difficulty in perceiving the position of your body parts? The next is assessing. Nursing assessment of sensory perceptual functioning includes six components. First is the nursing history, mental status examination, physical examination, identification of the client at risk, the client environment, and the client social support network. So the first is nursing history. During the nursing history, the nurse assesses the client's current sensory perception, usual functioning, sensory deficit, and potential problems. Next is mental status examination. Mental status is critical to any evaluation of the sensory perception process. Data on mental status including level of consciousness, orientation, memory, and attention span are usually obtained during the nursing history. The next is physical examination. Physical assessment determines whether the senses are impaired. Next is the specific specific sensory taste, including the following. First is visual acuity using a Snellen chart or other reading materials such as the newspaper and visual fields. Second, hearing acuity by observing the client's conversation with others and by performing the whisper test and the Weber and Riem tuning fork test. Next is olfactory sense by asking the client to identify specific aromas. Next is gustatory sense by asking the client to identify three tastes such as the lemon, salt, and the sugar. Next is tactile sense by testing light touch, sharp and dull sensation, 2-point discrimination, hot and cold sensation, vibration sense, position sense, and stereognosis. Next is clients at risk for sensory deprivation or overload. Client at risk for sensory intellectual alteration need to be identified to ensure that preventive measure can be initiated. Next, client environment. A nurse should assess the client's environment for quantity, quality, and type of stimuli. The environment may produce insufficient stimuli, placing the client at risk for sensory deprivation or excessive stimuli, placing the client at risk for sensory overload. Non-stimulating environment include those that first is severely restricted physical activity. Second, limit social contact with family and friends because appropriate or meaningful stimuli decrease the incidence of sensory deprivation. The nurse must consider the client's healthcare environment for the presence of the following stimuli. First is the electronic devices like computer, iPads, tablet, television, and smartphones. Next is reading material or toys for children. The next is clock or the calendar. Next is number and compatibility or roommates. And next and lastly is number of visitor. Assessment interview, sensory perception function like visual, auditory, gustatory, olfactory, and tactile, kinesthetic. Next is social support. Social support network, the degree of isolation an individual feels is significant influenced by the quality and quantity of support from the family members and friends. Next is diagnosing. Example of nursing diagnosis that may be appropriate for perception and cognition can include disturbance in thinking related to confusion and inability to recall past experience related to diminished cognitive ability. Next is sensory perception problem as the etiology. Depending on the data obtained, alteration in sensory perception function may affect other areas of human function and indicates other diagnoses. Next is planning. Planning include goals associated with the care of client independent of setting and those specific to the home environment. Next is planning independent of setting. The overall outcome criteria for clients with sensory perception alteration are: first is to prevent injury, second, to maintain the function of existing sense, third, to develop an effective communication mechanism, fourth is to prevent sensory overload or deprivation, fifth is to reduce the social isolation, and lastly is to perform activities of daily living or ADL independently and safely. The nursing intervention classification or NIC publication can be as a guide when planning care. Then next, Shaira.
So the next is planning for home care to provide for continuity of care, and a nurse must consider a client's needs for assistance with care in the home or residential treatment setting. Next is the implementing. The nurse can assist client with a sensory alteration by promoting health sensory function, help clients main and manage acute sensory deficit, and adjusting environmental stimuli. Next is promoting health sensory function. Detecting sensory problems early is one step toward preventing serious problems. The arousal mechanism for sensation is normally present at birth. However, it is undifferentiated. The special senses are also present at birth, although some changes in function occur during the growth of process. Next. In 2015, the Center for Disease Control updated updated the earlier hearing detection and intervention, also known EHDI tracking and surveillance surveillance system goals that were established in 2014. The guidelines were in review on the July 18, 2017. These functional standards are intended to identify the operational, programmatic, and technical criteria that all jurisdictional EHDI programs should be implemented during the process of developing, using and evaluating an EHDI information system. EHDI IS, their 8 goals are: goal number 1 is document and duplicated individually identifiable identi- identifiable data on the delivery of newborn hearing screening services for all infants born in that jurisdiction. Goal number 2 is support tracking and documentation of the delivery of follow-up services for every infant child who did not receive complete or past newborn hearing screening. So the next goal number 3 is document all cases of permanent hearing loss, including the congenital, late onset, pro, pro, progressive, and acquired cases for infants and children. Goal number 2 is document the all enrollment status, delivery, and outcome of early intervention services for infants and children under 3 years old with a hearing loss. Goal number 5, maintain data quality, accurate, complete, timely data of individual newborn hearing screening and diagnosis, early intervention, and demographic information in the EHDIS. Goal number 6 is preserve the integrity, security, availability, and privacy of all personally identifiable health and demographic data in the AHDIS. Goal number 7, enable evaluation and data analysis activities. Goal number 8, support dissemination of EHDI information to authorized stakeholders. So the EHDI program plays a vital role, and by achieving these 8 goals, the EHDI programs aim to ensure that all children with hearing loss have the opportunity to reach their full potential in terms of language development, academic achievement, and overall quality of life. Early detection and intervention for hearing loss are crucial in helping children develop language and communication skills, which are essential for success in school and social interaction. Next. So, early screening to detect problems in vision and hearing is essential as previously stated. Infants should be screened for hearing loss by 1 month of age, and preferably before hospital discharge. So, next is the health sensory function can be promoted with the environmental stimuli that provided appropriate sensory input. This input should vary and be neither excessive nor too limited, as may senses should be stimulates. Nurse should also teach the clients at risk of sensory loss of how to prevent or reduce the loss and should teach general health measures, such as getting regular eye examination and controlling chronic disease such as diabetes. Next. So, next is the impaired of vision. For clients with impaired vision, nurses need to do the following in healthcare settings. So, first is orient the client to arrange of the room furnishing, and maintain an uncluttered, uncluttered environment. Keep pathways clear and do not rearrange furniture without orienting the client. Ensure the housekeeping personnel are informed about this. Next is organize self-care articles with the client's reach and orient the client to his or her location. Next is keep the call light within easy reach and place the bed in the low position. Assist the client with ambulation by standing at the client's side, walking about 1 foot ahead, and following and allowing the client to grasp your arm and confirm whether the client prefers grasping your arm with the dominant or non-dominant hand. Next. Ay, wait lang. So the impaired, pakibalik. So the impaired of vision refers to the condition where an individual experiences difficulty seeing clear or distinguish objectives. This can be caused by a variety of factors, including the refractive errors like nearsightedness or farsightedness, or more severe conditions such as cataracts or glaucoma or macular degeneration. Next. Glaucoma, a group of disease of the eye caused by increase of intraocular pressure that can lead to optic nerve damage and eventual vision loss. A clear liquid, the aqueous humor, circulates inside the front of portion of the eye, nourishing the lens and cornea. In acute open-angle glaucoma, the anterior chamber angle remains open, but drainage of the aqueous humor through the canal sclene is impaired. So glaucoma is this can be caused by variety of factors, including the wait. So the glaucoma is so the glaucoma is So the glaucoma is a group of eye conditions that damage the optic nerve, which is essential for good vision. This damage is often caused by buildup of fluid and pressure in the eye, which then leads to early vision loss and eventually blindness if left untreated. Next. So next is the impaired of hearing. Impaired of hearing, clients with hearing impairments who are unable to hear the alarms of IV pumps and cardiac monitors need to be assessed frequently. They can be thought to use their visual sense to identify kinks in the IV tubing or loss of ECG lead and so on. An important consequence of decline in hearing as an individual ages is difficulty understanding the speech. Factors that influence this difficulty are the environment, rate of the speech, and presence of accents, environment that are noisy and reverberant, and cawing, hollow sounds can cause difficulty for the older adult. Older adults with the hearing loss have difficulty understanding the fast speech. So the impaired of hearing. So the impaired of hearing. The people with any degree of hearing loss, from mild to profound, including those who are deaf and those who are hard of hearing. Next, please. Next is impaired olfactory sense. Clients with an impaired sense of smell need to be thought about the dangers of cleaning and working with the chemicals. Strong chemicals such as ammonia, huh? Ammonia used in confined spaces such as bathroom may affect the client before they are smelled. These clients need to carefully inspect food for freshness, check its color and texture, and check the expiration and dates on the food package. So the infrared of olfactory sense allow us to enjoy the aroma of food, experience the scent of fresh flowers, and even detect the potential dangers like spoiled food or gas leaks. However, some individuals may experience impaired, impaired olfactory sense, which can significantly impact their quality of life. So there are various reasons why someone may have an impaired of smell, including the infection, allergies, head injuries, or chronic condition like Parkinson's disease or Alzheimer's disease. Next. Next is the impaired of gustatory sense. Change in the health can lead to impaired taste, which can lead to in, inadequate intake of required nutrition. Clients who have disease process such as cancer or nasal impairments, impairments can experience a dim, and dim, diminished a sense of taste. Many medications such as clarithromycin, and chemotherapeutic drugs produce a metallic taste. Alvarez Alvarez uh, Kamakaw, 2015, reported that clients with the head and neck cancer experience the taste and smell alteration. TSA, TSAS, their study aimed to determine the effect of TSAS on the overall quality of life. So, the impaired of gustatory sense, it is the sense of taste, can be caused by a variety factors including the age, certain medical condition, medical medication, and smoking and head injuries. Next. Next, please. Next is the impaired of tactile sense. Client with an impaired sense of touch may not be aware may not be aware of hot temperatures, which can cause of burns or pressure on bony prominence, which can produce pressure injuries. Clients with decreased sensation to temperature should be have the temperature adjust on their hot water and heater and test water temperature with the thermometer before bathing. Client with decreased sensation to pressure must change their position frequently. So the impaired of tactile sense, it is the reduced or diminished ability to feel or preserve sensation through touch. This can be caused by various factors such as nerve damage, injuries, medical condition, or aging. When an individual tactile sense is impaired, it can significantly impact their daily life as they may struggle to perform tasks that requires precise touch or coordination. For example, some with the impaired tactile sense may have difficulty buttoning shirt or even holding a pen properly. Next. Next is managing acute sensory impairments. When assisting a clients who have a sensory impairment, a nurse needs to encourage the use of sensory aids to support residual sensory function. Be promoting the use of other senses. C. Communicate effectively and And D, ensuring the client's safety. So, one of the important step uh, to uh, to managing acute sensory is uh, overload. Overload is to identify triggers and source of overload. This could be loud noises, bright lights, overwhelming smells, or crowded spaces. By recognizing these triggers, individuals can take proactive steps to avoid or minimize exposure to them, thus reducing the likelihood of experiencing a sensory overload. Another effective way to manage acute sensory overload is through relaxation techniques and sensory modulation strategies. Techniques such as a deep breathing, progressive muscle relaxation, and mindfulness meditation can help calm the nervous system and reduce the intensity of sensory overload. Next. Next is encouraging the use of sensory of aids. Many sensory aids are available for clients who have a visual and hearing deficit. Example are listed in the box 38.4. Sensory aids can be used in the healthcare setting as well as in the home. In all situations, the assistance of support of people needs to be enlisted whenever possible to help the client deal with the deficit. So the encouraging the use of sensory of aids can greatly benefit individuals who may have sensory impairments of difficulties. With the help of these aids, individuals can enhance their sensory experience and improve their overall quality of life. Next. So next is the promoting the use of other senses. When the one senses is lost, a nurse can teach the client to use the senses to supplement the loss. However, the type of stimulation needs to be adapted in accordance with the client's specific deficit. For the example is for the example is um, uh, uh, for example, as effective communication is active listen. This involves not just hearing what the other person is saying, but also make an effort to understand their perspective and emotion. Next. Next is box 38.4. Sensory aids for visual and hearing deficit. Phrase of visual. Eyeglasses of the correct prescription, clean and in good repair. Adequate, adequate, adequate room lighting, including the night lights. Sunglasses or shades are on the windows to reduce glare. Bright contrasting colors in the environment. Next is magnifying glass. Next is phone dialer with the large of numbers. Plug and wristwatch with large numbers. Colors code or textures code on stoves. Washer medicine containers and so on. Colored colored raised rings on dishes. Reading the material with large print. Braille or record books. Serves dog. Serves dogs. Service dogs. Next is hearing. First is the hearing aid in the good order. Next is the lip reading. Next is the sign language. Next is the amplified telephones. Next is the telecommunication device for the deaf, also known TDD. Next is amplified telephone ringers and doorbells. Next is flashing alarms clocks. Next, last one is the flashing smoke detectors. Next. So communicating effectively. Communication with the clients who have sensory impairments should convey a respect enhanced to the client's self-esteem and ensure that exchanges of the correct information. A client with a hearing impairment has to concentrate more than other individuals and therefore tires more readily, and fatigue compounded by an illness can further reduce the client's ability to hear. A client with a visual impairment is unable to observe most nonverbal clues during the communication and relies largely on the spoken word and tone of voice. So I said earlier, um, one of the important aspect of communicating effective is being able to choose the right words and the tone to convey one message using the language that is clear, precise, and easy to understand can help ensure that intended message is received accurately. Additional, being mindful of one's tones and demeanor can help the foster a positive and respectful communication environment which can lead to better understanding and cooperation. Next. Ensuring client safety. The nurses must implement safety precaution in healthcare setting for a client sensory deficit. Example of precaution including the keeping the bed in the lowest position and placing the call light with the reach. So overall, ensuring the client safety requires comprehensive approach that includes training staff members, inspecting and maintaining the equipment, and facilitate and protective client privacy and confidentiality. Next. Adjusting environmental stimuli. Hospitalized client function best when the environment is somewhat similar to that the individual's ordinary daily life. Sometimes nurses need to take a step to adjust the client's environment to prevent either sensory overload or sensory deprivation. So one if one so the one effective one way to effective adjust to the environment stimuli is being mindful of one's surroundings and paying close attention to the various stimuli present. By being aware the sounds of sights and smell that surrounds us, we can better adapt and response in a timely manner. Next. Next is box 38.5. Communicating with clients who have a visual or hearing impairment. First is visual impairment. Always announce your presence when entering the client's room and identify yourself by name. So, for example, is you introduce yourself first and know your identity, the client. Next is stay in the client's field of vision if the client has a partial vision loss. Next, speak in warm and pleasant tone of voice. Some individuals tend to speak louder than necessary when speaking to an individual who is blind. Next is always explain what are you about to do before touching the client. So like for example, explaining the procedure to the client what are you going to do because it is necessary and how to participate the clients to you. Next is explain the sound in the environment. Next, lastly is indicate when the conversation has ended and when you are leaving the room. Next is the hearing impairment. Before initiating conversation, convey your presence by moving to a position where you can see when you can be see or position presence by moving to a position where you can see where you can be seen, or by gently touching the client. Next is decrease background noises. For the example is the television before speaking. Next is talk a moderate rate and in a normal tone of voice. Shouting does not make your voice more distinct and in some instances makes understanding more difficult. Address the client directly. Do not turn away in the middle of the remark or story. Make sure the client can see your face easily and that is well lighted. Next is avoid talking when you have something in your mouth, such as chewing gum. Avoid conveying your mouth with your hand. Next is keep your voice at about the same volume throughout each sentence without dropping the voice at the end of each sentence. Next is always speak as clearly and accurately as possible. Articulate consonants with a particular care. Next is do not over overactive. Next is do not overacculate. Do not overacculate. Mouthing or overdoing articulation is just as troublesome as mumbling. Pan, pantomime. Pantomime. Pantomime or write ideas or use a sign language or fingers spelling as appropriate. Next is use longer phrases which tend to be easier understand that uh, 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 which tend to be easier understand than short ones. For example, would like to drink you are would you like a drink of water? Present much present For example is who would like a drink? Who would like a drink? Word choice is important. Important. Present much less difficulty than who would like a drink. Word choice is important. 15 cents and 50 cents, 15 cents and 50 cents may be confused, but half a dollar is clear. Pronounce every name with the care. Make a reference to the name for easier understanding. For example, Joan the girl from the office, or Walmart the big downtown store. Introduce a new subject to the client at the slower rate, making sure that client follows the switch to the new subject. Next. So next is preventing sensory overload. For clients who are thick, who are huh? For clients who are at risk of overstimulation, nurses should reduce the number and type of environmental stimuli. The nurse can counteract the nurse can counteract sensory overload by blocking unnecessary stimuli and by helping the client organize and alter response to the stimuli that cannot be blocked. So preventing sensory overload occurs when the brain is overwhelmed with the too much sensory input such as loud noises, bright lights, crowded space, and strong smells. This can lead to a feeling of stress, anxiety, irritability, and even physical symptoms like head jacks, head jacks, head 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 jacks. Headaches and fatigue. One way to prevent sensory overload is create a calm and organized environment. This can include decluttering space, minimizing distraction, and controlling the levels of noise and light in your surroundings. Next. Preventing sensory deprivation. For clients who are at risk for sensory deprivation, nurses can increase environmental stimuli in a number of ways. For example, newspapers, books, music, and television can stimulate the visual and auditory sense, providing object that can please pleasant providing objects that are pleasant to touch, such as pet to stroke, can provide tactical and interactive stimulation. Clocks that differentiate night from the day by color can help orientate can help orient a client to time. The olfactory sense can be stimulated by the presence of fresh flowers or plants. When communicating with the clients who has impaired of hearing, it is important to speak facing the client so that the clients can see the nose and mouth. This will enhance communication with the clients who read lips. So, in addition, preventing sensory overload, deprivation is occurs when individuals is deprived deprived of normal sensory experience, such as light, sound, touch, taste, and smell. This can have detrimental effects on a person's physical and mental well-being. To, pre- uh, to prevent sensory deprivation, it is important for individuals to engage in activities that stimulate their senses and maintain a, health, a healthy balance between work and leisure. Next. Next is the confuse. The confuse is client confuse can occur in clients of all ages, but is but it is most commonly seen in older people. Confusion often presents with subtle symptoms, and it is important for the nurses to differentiate between the accurate confusion, delirium, and chronic confusion, dementia. So delirium has a abrupt onset and cause that when treated reverse the confusion. While the dementia, often called chronic confusion, has symptoms that are gradual and irreversible. So the terms of accurate confusion and delirium are often used interchangeably by most health professional, with the understanding to favor to the use of acute confusion and physician using the term of delirium. Acute confusion, however, is a nursing diagnosis that stems from the client experience and behavioral response to their health condition. So acute confusion can result from the drug or alcohol intoxication in all ages and is more common in young adults. So the main cause of dementia is Alzheimer's disease. So I said earlier, so the acute confusion is more common in young adults, and the main cause is of the dementia is Alzheimer's disease. Next. Next is the post post postoperative delirium. Postoperative delirium occurs in older hospitalized clients following surgery. This is a very serious complication that result in increased morbidity or morbidity and mortality. Factors that contribute to the development of delirium are increased age, cognitive impairment, sensory impairment, and Other comorbidities, and prolonged hospital stays. Trinley and Gold, Trinley and Gold in 2016. So the components of delirium include the following. The client has the reduced ability to focus, sustains or stiff, sustain or shift attention. The client exhibits a change in cognition. The client exhibit a change in cognition that may include memory impairment, disorientation, or development of perceptual disturbance. This change varies from the initial baseline assessment of the client. The change of the change. Oh my God. The change of disturbance develops over a short period of time of fluctuates during a 24-hour period. Wait lang. Sige, next. So there are also clinical subtypes of delirium based on the psychomotor activity and levels of alertness. With upper active delirium, the client can be less. The client can be less agitated and disoriented. With the hypoactive delirium, the client is quiet, confused, and disoriented, and display apathy. This may be incorrectly assessed as depression or dementia. In mixed delirium, the client has symptoms of both hyperactive and hypoactive delirium. The client will present with the symptoms of one type of delirium that will be resolved and then present with the opposite type. So in addition, postoperative delirium is a common condition that occurs in someone patient following surgery. It is characterized by state of confusion and disorientation that can vary in severity and duration. This condition typically manifests with the first few days after surgery and can last for days, or even weeks. Next. So next is the confusion assessment method, also in short CAM. Is considered the gold standard in identifying the clients with delirium. In addition, the family of CAM or FAM is a screening tool in which family members are interviewed to maximize detection of delirium in the clients. The tool was adapted from the CAM instrument to identify acute onset, fluctuation in the delirium course, inattention, disorganized through the process, diminish a level of consciousness, disorientation, perceptual change, and hallucination. Other tools include the mini-mental state examination, or in short, MMSE, the delirium index, DI, and the NEECHAM confusion scale. Example: for example, Ball it at all at 2017 small 3 ling Lincoln, Gustafson, Lawson, and Angstrom. Angstrom 2015. So the CAM has shown tool for the early detection of the delirium in older adults, and easy to administer and can be complete in a relatively short amount of time, making it making it making it is a practical and efficient screening tool for healthcare professional. By for hel- uh, by identifying the delirium early, healthcare providers can initiate appropriate treatment and intervention to help prevent further deter, uh, deterior, deterior, deterioration and improve outcomes for patient. Next. Next is the evaluating. Using the measurable and desired outcomes developed during the planning stage as a guide. The nurse collects the data needed to judge whether the client's goals and outcomes have been achieved. Example of the client's outcome and related indicators are shown in the nursing care plan. If the desired outcomes are not achieved, the nurse and the client and support people if appropriate needed to explore the reason before modifying the care plan. So the evaluating so the eval so another important aspect of evaluating is collecting and analyzing the data to support the assessment process. This can involve gathering information through the surveys, through the surveys, interviews, observation, or other research methods. So by analyze the data, evaluators can draw a conclusion and make informed recommendation based on the evidence. Evaluating evaluating allows allow, Evaluating allows for informed decision making, leading to better outcomes and improvements in performance. Next.
Next is the nursing care plan and sensory perception disturbance. You can refer in our funda books po if meron pa kayo kasi hindi siya masyado maklaro sa PPT.
Next, please. Next, please.
And lastly, the concept map. Sensory perception disturbance. Um, you can read it in our books kasi hindi siya masyado clear dito sa PPT po. So that was all for our report entitled sensory perception. That's all. Thank you po.